Hello, my name is Dr. Carlo Oger. I'm a board-certified emergency physician and I produce patient education videos like this one regarding the general discharge instructions and care after you've been diagnosed with certain disorders. You can find a whole library of these kinds of videos at PatientEducation.Video. In this particular video, we're going to be talking about shingles. If you've been diagnosed with shingles, but you have trouble moving your arms, leg, or face, or you have a seizure, you must call your local emergency number. This is the United States, you will call 911. There are other reasons why you should seek emergency care. If you become confused, if you have difficulty with your speech, if you have dizziness or severe headache, or hearing or vision loss, if you have a painful, red, warm skin around the blisters, or the blisters start to drain pus, if your neck feels stiff or you have trouble moving it, if you feel weak or you have a headache that is severe, if you have cough, chills, and fever, if you have abdominal pain or nausea, or if you're vomiting to the point you can't keep fluids down, if your rash becomes more itchy or more painful, if your rash spreads to other parts of the body, if your rash worsens or does not go away even after you take medication, or if you have any questions or concerns about your condition and care that you do not understand. Now that you know when it's an emergency to seek both emergency care or urgent care, or just follow up with your primary care doctor, let's talk about what is shingles. Shingles is the result of herpes zoster. It is a painful outbreak of the skin that causes blisters and sores, and it is the result of the reactivation of the varicella zoster virus, the virus that causes chickenpox. See, when you have chickenpox, the virus goes to sleep in your body after you've had the chickenpox. Declining antibodies over time and both physical and emotional stress will cause the virus to wake up, causing this painful rash. 1 out of 10 people who have had varicella or chickenpox as kids will have shingles later in life. There is no cure for shingles. Some medications will help relieve the symptoms and to prevent complications. There is, however, a vaccine, Zostavax, now available that helps in the prevention of the shingle outbreaks, especially those at high risk, like those with comorbidities or immune disorders, and those over age 60. What are the symptoms? The virus stays dormant in your nerves near the spine. The activated virus travels along the nerves to the skin and then causes the rash on the skin in groups of bands and at the nerve endings. The rash usually stays as a band going across part of the body, but only on the one side. It almost never crosses the midline. The rash can occur anywhere in your body. Early vague symptoms include mild itching, tingling, pain, headache, fever, and other flu-like symptoms. The rash that follows consists of many small, fluid-filled blisters in groups that dry and scab over and heal over the weeks to follow. Healing is usually complete, but scars may persist in the area of the blisters, as that broke the skin and can cause scars. The amount of pain and discomfort experienced varies from person to person. Some patients compare the pain as being burned with a hot frying pan. Some patients will experience a burning discomfort in the area days before the rash appears. In medical terms, the painful skin sensation is termed dysesthesia, where cold can feel hot, hot can feel cold, and so on. A significant number of people, especially those older than 50, can have pain for more than 30 days after shingles. This is called post-herpetic neuralgia, and sometimes can last even more than just a month. It can be quite severe and interfere with your daily activities. People who scratch the rash can also end up introducing bacteria into the broken up skin. Bacteria that normally live in your skin will enter the deeper tissue and cause a skin infection or cellulitis. Shingles can affect the face, and when it does, the medical professional needs to make sure that the eye is not involved, as this can cause scarring and blindness. Diagnosis of shingles. In the early stages of the dysesthesia and flu-like symptoms, the diagnosis is easily missed. But as the rash develops, it produces a very characteristic features that just seeing the rash results in an accurate diagnosis by the medical provider. Treatment. The main goal of treatment is to decrease the duration of the infection, to reduce the pain, and to prevent complications. Antiviral medication like acyclovir or valacyclovir needs to be started early, best if done within the first 2 to 3 days, and that can help both the rash, the pain, the duration of the symptoms, and prevent complications. We sometimes use steroids to decrease the nerve inflammation and pain associated with the rash. This is an extremely painful condition, and pain can be controlled with topical measures like lidocaine ointments and patches. But most times, pain medication like narcotics will be necessary in order to control the pain. If you are prescribed narcotics, you should know the side effects of it. It can cause itchiness, nausea, and can produce significant constipation. If you are prescribed narcotics, I would go ahead and start using some stool softeners alongside the pain medication. If you get itchy, you can just use plain Benadryl, and the nausea, you should really ask for the physician or provider to give you some anti-nausea medication. If the patient is high risk, then you should not, or for whatever reason, cannot use narcotics, then pain management specialists can perform a nerve block to manage the acute illness pain, as well as the complication of post-herpetic neuralgia. Now let's talk about the do's and don'ts of shingles. Do tell your doctor about your other medical problems and of any over-the-counter medications that you take, as these may interfere with the ones that he will be prescribing. Do tell your doctor if you are pregnant or breastfeeding. Do keep your blisters clean. Soap and water is enough. You don't need alcohol or peroxide. And don't bandage the blisters, and try not to scratch them. Do avoid anyone who has never had chickenpox or didn't get immunized, or if there's pregnant women or people with cancer. You cannot get shingles from shingles. Most people have had chickenpox as kids, so they are immunized to shingles already. But if they are those people that we just talked about, older, never got immunized, never had chickenpox, pregnant, or people with cancer, those are the ones you need to avoid. They can get chickenpox from shingles, but you cannot get shingles from shingles. The virus is spread by direct contact with the fluids or blisters, so just standing 5 feet across will not result in infection. Usually, you cannot spread the infection once the blisters dry up. But to be safe, I would wait 1 or 2 days after they dry up to make sure it's all complete and no longer infectious. Do get medical care as soon as possible if you think you have shingles. The earlier the treatment started, the better the chances of not getting post-herpetic neuralgia and limiting the complications. Do call your doctor if the rash is over your face or tip of your nose. If the pain does not improve after the rash begins to heal, or if the rash looks infected. Well, how does it look infected? It has a deeper redness, it becomes warm, it becomes deeper painful. It just changes the nature of the rash. And if that happens, you need to have it looked by a medical professional. Do not stop taking your medications or change your dose because you feel better, unless your doctor tells you it's okay to do so. Do not shave in the area that's involved by the rash or the area right around it. And do not scratch, contaminate, or break the blisters. And that's it for today. That's everything you need to know about shingles. I hope you find this video interesting and educational. You can find many other videos like this one at PatientEducation.Video. I will see you on the next one. Bye-bye.